A ban on gender-affirming health care for transgender youth is now one step closer to becoming law. WRTV State House reporter Meredith Hackler shows us why some feel this bill is government overreach and why others say this is a needed government intervention.
Gender-affirming care is on the line. Indiana senators passed a bill out of committee that would ban gender-affirming care for trans youth across the state.
It is arrogant because it says that we parents are incompetent and unable to make medical decisions for our own kids.
Trans lives matter! Parents, transgender youth, and LGBTQ advocates gathered at the State House for the second time this week, this time to oppose Senate Bill 480. It would ban the use of hormones and puberty blockers for people under the age of 18. It would also ban any and all gender-affirming surgeries for people that age as well. On top of that, kids in Indiana currently using hormones or puberty blockers would have 6 months to stop using them if this bill goes into effect.
If I had not received the counseling that was necessary, I would not be standing before you. I would have been another statistic to you. I have been the 45 seconds. I am 20 years old and I remember first questioning my gender when I was 7 in the first grade, and I was scared, and I honestly still am.
The bill also had opposition from doctors who work at Riley Hospital for Children.
When a patient desires gender-affirming hormone and the parent consents, hormones are prescribed at low doses, slowly advancing over 18 to 24 months, with medical visits every 3 months, inclusive of laboratory tests.
There were also several people in support of the bill, a few who have detransitioned.
Instead, I was affirmed down a path of constant medicalization, one that I cannot undo and I will live with for the rest of my life.
But most of those people who testified got their surgeries when they were 18 and not in the state of Indiana.
Did you receive the double mastectomy in Indiana?
I did not, but if you are implying that this care does not happen in every state in the United States, you are incorrect.
Many of the individuals who testified in support of Senate Bill 480 admitted to not being from Indiana. Despite all of the testimony, senators passed the bill out of committee with a vote of 8-3. It now heads to the full Senate for consideration. Working for you at the State House, Meredith Hackler, WRTV.
Well, those who testified on behalf of Riley Hospital for Children say they never perform gender-affirming surgeries on people under the age of 18. The bill must pass out of the Senate by Tuesday, or it's dead.